what's the importance of sleep and how many hours somebody should get each night, or at least throughout the course of a day?
Okay. The typical advice usually is about 8 hours of sleep per day. That's the average. If you look at as you age, your amount of sleep, generally the average amount of hours goes down. It starts out at about 12 hours when you're a newborn infant. It kind of goes down to about 8 hours when you're about that old, about 8. Then it starts to climb back up to about 9 hours, the average mostly when you're college age, and drops all the way back down to about 6 hours as you get older. Sleeping is associated with a lot of health issues if you don't get much sleep. People that don't sleep very well have trouble losing weight also, but also things like depression. People just feel tired, as you know, and just don't perform or function very well.
And could you explain a little bit on what metabolism does for the body and how somebody might be able to increase their metabolic rate or help improve their metabolism?
Metabolism is basically the amount of calories you burn, sort of a basic metabolic rate, I think that's what you're asking, of someone when they're sitting around doing nothing. And it's, again, a kind of something people look at when they're trying to lose weight. Again, the idea being, why do some people eat whatever they want to eat, and they can, like myself, and they can lose whatever weight they want, and some people, they just look at food and they gain weight. So, and a lot of people think that has to do with just basically your basal metabolic rate, or how much calories you burn sitting around doing nothing. That's something that you can affect in some ways. For example, the not having as long a fast period, again, that'll help as far as having more frequent meals throughout the day will help increase your basal metabolic rate. Building up some muscle mass, again, helps increase your basal metabolic rate, the amount of calories you burn doing nothing.
And does sleep have any role in your metabolic rate?
Again, there are some studies, if you look at people that don't sleep well, they tend to have trouble with obesity and excessive weight. So again, getting an adequate night's sleep has been shown to have some good health benefits.
And does the BMI calculator really work? Is it really showing if somebody is actually overweight, or are there other things that people should look at if they are?
We do use BMI. BMI is kind of basically a height compared to weight as a measure, but again, there can be problems with it. So people that are like elite athletes and have a lot of muscle may have an unusually high BMI, and it may be more muscle mass. We also use other things like waist circumference is one of the measures we commonly use to kind of decide whether people are overweight or not.
And for those people looking to limit their carbohydrates, because you explained the difference between some of the slow digesting carbohydrates and the impact that they'll have on the diet compared to the other carbohydrates?
So carbohydrates, and a lot of people look at them, especially diabetics, as a better form of sugar. Carbohydrates are chains of sugar bound together. That's what a carbohydrate is. And because of it, when you digest and absorb it, you absorb more slowly. So if you compare that to, say, a piece of candy, which is fine refined sugar, your sugar can spike up really quickly when people eat sugar, versus if they eat a piece of bread that has carbohydrates. You will have a rise in sugar, but it will be slower and over time. So for a lot of people that have some trouble, that's one of the things that you can think about as far as helping to monitor your sugar.